Hi everyone, in this video I will explain hip bone, its side determination, its anatomical position and its important features. Hip bone is also called as innominate bone or coccyx bone. It is large, flat and irregular bone. Posterior-medially it articulates with sacrum and forms sacroiliac joint, and laterally it articulates with head of femur and form hip joint. This one is hip joint. Hip bone consists of ilium, ischium, and pubis. Let us discuss ilium, ischium, and pubis one by one. This upper flat and expanded part is called as ilium. This ilium consists of a smooth articular surface which is called as auricular surface. Through this surface, ilium articulates with sacrum and forms sacroiliac joint. Superior to this surface, there is tuberosity, which is called as iliac tuberosity. And this upper curved part, which consists of two lips, is called as iliac crust. This iliac crust ends at both ends by forming spine. This upper spine, which is directly superior anteriorly, it is called as anterior superior iliac spine. Inferior to this spine, there is another spine which is called as anterior inferior iliac spine. Posteriorly, there are also two spines which are named as posterior superior iliac spine and posterior inferior iliac spine. Inferior to this posterior and inferior iliac spine, there is a notch. This notch is called as greater sciatic notch. This one is lateral view of hip bone, and on the outer surface of ilium there are three gluteal lines which are named as posterior gluteal line, and this one is called as anterior gluteal line, and this third and last one is called as inferior gluteal line. And this part which is here shown blue is called as ischium. This ischium consists of upper thicker part which is called as body of ischium, and lower thinner part which is called as ramus of ischium. This ischium consists of a bony prominence. This bony prominence is called as ischial spine. Inferior to this ischial spine, there is another notch which is called as lesser sciatic notch. Actually, both of these notches are converted into foramen by sacrospinous and sacrotuberous ligament. Let me show you. Here you can see this one is greater sciatic notch, and this one is greater and this one is lesser sciatic notch, and both of these notches are actually converted into a foramen, greater sciatic foramen and lesser sciatic foramen by this sacrotuberous ligament and this sacrospinous ligament. And this third and last part is called as pubis. This pubis consists of two thinner parts which are called as rami. This upper one is called as superior pubic ramus, and this lower one is called as inferior pubic ramus. This inferior pubic ramus join with ramus of ischium and form istiopubic ramus, and this smooth surface is called as symphyseal surface. Right and left hip bone articulate with each other anteriorly at the symphyseal surface and form symphysis pubis. Let me show you. Here you can see both hip are articulating with each other at this symphyseal surface and are forming symphyseal pubis. And this tubercle which is present above the symphyseal surface is called as pubic tubercle, and median to this pubic tubercle there is a sharp margin called as pecten pubis, and on the outer surface there is also a sharp line which is called as obturator crust. This foramen which is formed partly by this ischium and partly by this pubic, this one is called as obturator foramen. This obturator foramen is closed by obturator membrane except at this obturator groove. Rest of all of this is closed by obturator membrane. and this obturator groove allow obturator nerves and vessels to pass through it. And this horseshoe-shaped depression, which is directly laterally, is called as acetabulum. This acetabulum articulate with head of femur and form hip joint, and this depression you can see is deficits inferiorly, and this one is called as acetabular notch. All of this acetabulum is further deepened by fibrocartilaginous acetabular labrum, and this acetabular labrum also close this notch, and here acetabular labrum is called as transverse acetabular ligament. Now let's talk about its site determination. Its site determination is also very easy. You can identify its lateral side by this acetabulum, and the opposite side will be its medial side. And its upper end consists of this flat expanded ilium, which is located above this acetabulum. And this shallow depression, which is called as iliac fossa, it is directed forward. Now at the end, let's talk about its anatomical position. In anatomical position, this pubic tubercle and this anterior superior iliac spine should be in the same coronal plane, and also this symphysial surface should be in the median plane, and this pelvic surface of the symphysial pubis should be directed upward and also backward. That's all about hip bone.